So we can see here that my incisal ledges are all in line with each other. The distal incisal ledge of the canine matches the mesial cusp ridge of the fore. This is perpendicular to my intended line or the crest of the ridge, and I'm just going to keep going with it. But before I do any more posteriors, I need to go to the other side to make sure that I have a mirror image of what I just did there, or possibly go back and tweak it. So the next tooth that I'm going to set up is tooth number 1-2. Now, I didn't have interference with 2-2, so I don't anticipate any interference between the base plate and the back of 1-2. So I'm just going to add a little bit of wax. I like to flow some hot wax before anything to make sure I have good adaptation between the wax layers. And then I'll take a wax that's semi-melted. Yeah. Be sure when you're adding wax to support the tooth, it's just enough to support the tooth. And also, don't get any wax between the contact surfaces of the teeth, which is usually at the incisal or occlusal third. So once again, I'm going to use the previous tooth as a guide in terms of the labial lingual position. It's fairly close. In terms of the position in relation to the setup plate, the long axis, and rotation of the tooth. So I'm going to close this and see how that lateral now relates to the setup plate. It looks like it's too high. So I need to move that lateral further down to match the other side, if the other side is correct. So without going through too much work, I'm just going to take my blade and see if I can just poke it down while the wax is still relatively warm. And maybe just lift it up a little bit. And then introduce some more wax. That looks pretty good. At least it's better. Introduce some more wax under the tooth to support it. I'm starting to develop a sense of symmetry here. So we'll look at it like this. It looks pretty symmetrical. I don't want to put too much pressure on this tooth yet because it's still, the wax underneath it is still soft. But again, you can see that the incisal edges are matching, or they're very close to each other. And I'm going to continue with my right canine. So introduce some hot wax to begin with, and then some softer wax just to support the canine, maybe a little bit more. And I'm going to position the tooth in relation to 1-2. With having the mesial incisal edge match the lateral, and make sure that my long axis is correct. So I might have to over rotate this tooth a little bit. It's a little bit tilted towards the distal. And now we can see that the canine cusp hits exactly on that canine cuspid line that we had from our bite block. So just to get a better idea where I'm going with this, I'm going to seal the wax around it. I think I'm close. But taking a second look, you should always go back and assess your work, so you don't go too far ahead. I'm looking at the lateral, and right now it appears that the distal third of the lateral appears slightly over-rotated towards the lingual. But I'm not going to change it now. I'm going to leave it until I put on the first bicuspid, because that's might change the position of the canine, and maybe I don't have to change the lateral. So I'm going to continue with my first bicuspid on the right side. So I'm going to remove it from the card and see if I can get away with placing this tooth on without doing any tooth reductions. So tentatively position the tooth that looks relative to what you did before. It might not be 100%, but let's just see where we go with it. So it looks like it's symmetrical. Let's see how this relates now to my setup plate. Close it slowly. That worked out pretty nice. The only thing is, I don't see the lingual cusp of that first bi touching the plane of occlusion. So I'm just going to gently poke the cervical third and rotate it in. Even go back and poke it up a little bit and close it while the wax is still soft. And that looks pretty good. So I'm happy with that position. So therefore, I'm going to seal this down. Make sure that we have proper rotation of the tooth. So therefore, the transverse axis of the tooth should be perpendicular to the lower crest of the ridge, or this imaginary line running the length of the crest of the ridge on the lower that we have here. Okay, over the crest of the ridge, just like we have on the other side. Just going to seal this tooth a little bit more. And just taking an overall look here, I definitely need to go back and change the rotation of the 1-2 to be in line with the mesial incisal edge of the 1-3. It looks like the distal of the 1-2 is over-rotated lingually. Very simple change. I'm just going to go back and heat up the wax around the 1-2. And while I'm supporting the mesial third of the tooth with my finger, I'm going to poke the distal third with my blade so that tooth just rotated, I think, in a much better position in relation to the 1-3 as well as the 1-1. and nothing has really changed vertically. It's still about a 0.5 millimeter to 1 millimeter off the plane of occlusion. And same thing on the other side with a 2-2. Canine is on the setup plate. The first bicuspid is on the setup plate. First bicuspid is on the setup plate. The canine on the right side is on the setup plate. But look what's happened to the centrals. They're slightly elevated off the setup plate now, while the pin is at 0 and while everything is coming together. And the reason that happened is because the wax shrunk as it cooled down. So I need to reposition those centrals ever so slightly. So I'm not going to use a lot of heat this time, just enough to soften the wax ever so slightly. So I can move those two centrals with having their incisal edges on the setup plate or on the plane of occlusion, like so. It's not a big difference, or a big change, I should say, but it makes a big difference. Okay, I'm just going to seal everything down, make sure nothing moves around. I'm going to check the position of 1-4, or at least the lingual cusp of 1-4, against the crest of the lower ridge. I haven't done that yet. So therefore, I can remove the setup plate, remove my table, remove my incisal pin, and overclose my articulator and see how that lingual cusp relates to the crest of the ridge. And for the most part, I think that looks pretty good. It looks like it's sitting over the crest of the ridge around this point. That's what I see from my angle, which is pretty good. So it looks like I'm on the right track. So let's summarize this part of the setup, because this is very important. What we need to have here, we need to have everything in line when we're looking at it from an occlusal view. All the incisal edges lining up with each other. The mesial buccal ridges of the 4s line up with the distal incisal edges of the 3s. The centrals canines, and first bicuspids, lingual and buccal cusps, or first bicuspids, are on the plane of occlusion. The laterals are slightly elevated. There's a sense of symmetry when we look at it from this view, and each quadrant mirrors the other. And we've ensured that the lingual cusps of the first bicuspids are over the crest of the ridge. So this will be the first segment that we want to make sure that we have correct, because if we don't, if you make any mistakes now, they will trickle down to the rest of the setup, and it makes it virtually impossible to start thinking about balanced occlusion. The other thing I should mention is make sure that the labial inclination that you created with your centrals mirrors each other. It's also mirrored by the laterals. So when you rotate the case, make sure that the labial inclination that you created with 2-1 is duplicated in 2-2. One last thing that I almost forgot to mention, and it's very important. If we look at it from a frontal view, you notice that the 2-4 right now, it appears that it has a lingual inclination, right? On the buccal surface. Do you remember the buccal slope angle that we're talking about with our occlusal rims? This is exactly what we're trying to mimic there. The problem here is that the 1-3 inclination does not match the 1-4. So I have to go back and change the 1-3 angle. Now that I have the 1-4 in there, I have to go back and soften the wax here and pry the cervical third of this tooth more towards the facial. Like so. I can just put my instrument in here and poke it out without changing the incisal third, without changing the long axis of the tooth. And now that tooth now is more in line with the 1-4. You notice the buccal slope now? That's established by the 1-4 by having the the lingual and buccal cusp tips on the plane of occlusion. It's now reflective in the 1-3. And as I'm looking at the case now, it looks like the 2-2, or at least the cervical third of 2-2, is slightly positioned lingually. So I'm going to pull that out a little bit. So it's almost like a trickle-down effect. You move one tooth, and very often you have to move at least 1 or 2 teeth adjacent to that. Ever so slightly. I probably moved that tooth about 1/10 or 2/10 of a millimeter, which is very negligible, but it does make a huge difference in terms of aesthetics. So if we look at the buccal slope angle between 2-4 and 2-3, it looks like it's the same. If we look at the other side, I hope you can see that the cervical third of 1-3 needs to be positioned a little more labially in order for that 1-3 to match the 1-4. So I'll do that again. And this is the reason why I like going all the way to the first bicuspids with a maxillary setup and stop there, because the buccal slope angle created by the 1-4 and 2-4 trickles down to the 1-3 and 2-3, and then it might require you to change the 1-2 and 2-2 and so on. Hopefully not too far. Okay, move that out a little bit and see how that looks now. That looks a whole lot better. I'm going to leave the 2-2 or the 1-2 for now. I can always go back and change it once I have a better overall sense of where I'm going with this. But I think for the most part, I think I'm pretty good. And just take a little bit of time now to seal the wax around the teeth and make sure there's no wax obstructing your view of the teeth. So notice I'm holding my articulator in a way so the wax flows away from the tooth surface and just enough to support the tooth. So when I look at the teeth like this, there's a lot of tooth structure there that I can assess and gives me a better idea how I'm doing.